Picture a scenario. You wake up early, sensing that very constant weight deep in your pelvic zone. You visit the bathroom, sit down, and you wait. And you wait, and nothing happens. You strain a tiny bit, still nothing. You wonder, perhaps I just require a second cup of coffee. So you arise and try once more an hour later. Same outcome. By the third or fourth attempt, something has shifted and not in a positive way. Now there is actual pain. A deep, dull, almost rhythmic throb that radiates from your lower spine all the way down into your hips. You start to feel stuffed, puffy, almost feverish, and a small little voice in the back of your mind starts murmuring, something is extremely wrong. If that tale sounds familiar, if you are viewing this right now and that situation felt a little too close to home, I want you to halt whatever else you are doing and pay very close attention to the next 18 minutes, because what I am about to tell you could actually protect you from a hazardous, potentially life-threatening medical crisis. My name is Dr. Lana Mitchell, and today we are having the discussion that nobody wants to have, but that millions of people, especially seniors over the age of 60, urgently need. Today's subject, waste that is physically lodged inside the rectum. What is it? How does it occur? What are the warning signals your body emits before it becomes disastrous? And most importantly, what do you do about it? Right now, step by step. I guarantee you, by the time this video is over, you are going to comprehend your own digestive system in a way that no physician has ever taken the time to clarify for you. And that insight, that is going to be the most vital thing you carry out of this discussion. So, take a slow breath, get relaxed, and let's get into it. Before we begin this, I would love to hear from you. Where are you viewing from today? Put your city or country in the comments below. I read every single one, and it really helps me see who is part of this community. All right, now let us get into it. And I want to start not with the remedy, but with the problem itself, because here is the thing most people get wrong. They treat digestive matters like a dripping tap. Ignore it for a while, put a bucket under it, hope for the best. But what we are dealing with here is not a leaky tap. This is more like a pipe that has completely locked up, and understanding exactly why it occurred is the key to both resolving it right now and making sure it never happens to you again. The medical term for what you are experiencing is called a fecal impaction. But forget the clinical terminology for a moment. In plain human terms, here is exactly what is occurring inside your body right now. Your large intestine, that 5-foot-long tube that coils through your abdominal cavity, has one very important task to soak up water from whatever passes through it. It is incredibly effective at this task. Excellently effective, actually. The problem is that when waste stays inside the colon for too long without moving forward, your body doesn't know to stop withdrawing moisture. It just keeps pulling water out hour after hour, day after day, and what starts as soft, manageable waste gradually shifts into something that has the texture and thickness of hardened clay. Now, here's the part that catches most people completely off guard. This situation almost never occurs suddenly. It is not like a light switch that flips from fine to emergency overnight. What actually occurs, especially in older adults, is a slow, steady progression that develops over 3, 4, sometimes even 7 or 8 days. And during most of that time, you may feel only slightly uncomfortable, maybe a little full, maybe slightly sluggish. You might even still be using the bathroom, but each time you go, you are only passing a tiny bit of what your body needs to discard. A little bit gets out, but a significant portion stays behind. The next day, the same thing occurs. And the day after that, think of it like this. Imagine you have a garden hose and you are trying to shove a large, rough, jagged rock through it. That rock is not going to slide. It is not going to shrink. And the harder you shove, the more it wedges in. That is literally the physical situation occurring inside your lower digestive tract. And the harder you strain and push on the toilet, the more you are actually squashing that mass further rather than moving it. But here is what I really need you to grasp. And this is critically vital for older adults especially. The older we get, the more susceptible we are to this exact scenario. After the age of 60, several biological shifts occur simultaneously that significantly increase the risk of fecal impaction. Intestinal muscle movements naturally slow down. Pain sensation in the gut becomes less precise, meaning you may not feel the urgency cues as clearly. Many seniors are on medications. Blood pressure pills, pain pills, antidepressants, iron tablets, even calcium that significantly slow movement. And the natural thirst reflex declines with age, leading to chronic low-grade dehydration that the body doesn't even recognize as thirst anymore. So this is not a failure of your body. It is not your fault. It is a perfect storm of biological shifts that nobody ever properly cautioned you about. Before we begin, take a second and tell me your name and where you're joining in from. I go through the comments and I truly want to know who I'm talking to and helping here. Now, I want to spend a moment here on something genuinely vital because the symptoms of a fecal impaction can be deeply deceptive, and getting them wrong can lead people to take exactly the wrong step, which can make everything significantly worse. The first confusing symptom, watery liquid leakage. Now, stay with me here because this is the one that sends the most people in the wrong direction. You might be sitting there thinking, but I'm not constipated. I actually have diarrhea. And here is the startling truth about that. When a solid, rock hard mass of waste completely clogs the rectal passage, the newer, looser waste coming down from higher up in the colon has nowhere to go. So it does the only thing it can do. It leaks around the edges of that solid clog and drips out as watery liquid. This is called overflow or paradoxical diarrhea, and it deceives people into thinking they have a stomach bug or a GI bug rather than a clog. The hazard in this, people reach for anti-diarrheal pills. And those pills, the kind that stop intestinal activity, are absolutely the worst thing you can take in this situation. They don't just stop the liquid output, they slow the entire digestive system, allowing the impaction to continue solidifying and growing. If you have watery leakage along with a heavy aching feeling of rectal fullness, do not touch anti-diarrheal medication. Please. The second confusing symptom involves your bladder, and this one shocks almost everyone. You may suddenly find yourself struggling to pee. You feel the urge, you go to the bathroom, but only a painful drip comes out. Or you find yourself needing to go every few minutes, but barely producing anything. This is not coincidence. Your rectum and bladder are anatomical neighbors. They share a very cramped pelvic space. When your rectum is bloated and swollen with a large hardened mass, it physically squashes the bladder wall from behind, partially blocking the urethra and making normal peeing difficult or even impossible. In severe cases, this urinary blockage becomes a medical crisis in its own right. The third symptom that gets missed is lower back pain, a deep nonspecific ache in the lumbar area that doesn't seem linked to your bowel at all. Many people assume they pulled a muscle or that it's their arthritis acting up. But when rectal pressure builds to a significant level, the pain spreads outward into the lower back, down into the thighs, even into the hips. If you're experiencing unexplained lower back discomfort alongside any bowel irregularity, that combination is a warning sign worth taking seriously. And the fourth symptom, especially relevant for older adults, sudden changes in mental focus or confusion. This one sounds odd, I know, but there is significant clinical proof showing that in seniors, significant bowel clog can contribute to what looks like a cognitive event: disorientation, mild confusion, unusual restlessness. This is due to the systemic physical stress and discomfort the body is under, combined in some cases with early toxic buildup. If an older loved one seems suddenly off mentally without obvious reason, always consider their bowel status as a contributing factor. If this is the kind of info nobody ever told you before, hit subscribe right now because there is a lot more where that came from. And trust me, what comes next, you need to hear. Let me be direct with you now because I believe you deserve the truth shared clearly, not wrapped in soft language that weakens the message into something that doesn't land with the weight it deserves. A fecal impaction is a real medical crisis, not a nuisance, not something to wait out. If left ignored, the results escalate in a very predictable and very serious way. Stage 1, the intestinal wall, which is living muscle tissue, becomes severely expanded beyond its working capacity. Blood flow to that stretched tissue begins to drop. The muscle begins to lose its ability to contract and push waste forward. Essentially, that section of bowel starts to go quiet, what doctors call an ileus. Stage 2, as pressure continues to build, the swelling can spread upward, affecting higher sections of the colon. What started as a localized rectal impaction can turn into a broader colonic blockage. Nausea and vomiting begin. Abdominal swelling becomes visible. The person looks and feels truly ill. Stage 3, and this is the one I need you to hear clearly, is bowel tear. The intestinal wall has physical limits to how much it can expand. When those limits are surpassed, the wall breaks. And when that happens, the contents of the bowel, waste material, bacteria, toxic byproducts of digestion, spill directly into the sterile abdominal cavity. What follows is a rapidly advancing infection called peritonitis, and it is life-threatening. Without emergency surgical help, it is fatal. I am not sharing this to scare you. I am sharing it because the risks of ignoring this condition are real, and you have every right to understand them clearly. The gap between serious but manageable and life-threatening crisis is not as wide as most people assume. So, what does the danger zone actually look like from the inside? Here are the signals that mean you need to call 911 or get to an emergency room without pause. A rigid board-like belly that is tender to the touch. A high fever above 101 degrees Fahrenheit. Sudden, severe abdominal pain that is steady and worsening, not crampy and sporadic, complete inability to pass gas at all, vomiting that does not stop, or any sudden drop in blood pressure accompanied by confusion and cold, clammy skin. These are not wait-and-see symptoms. These are go-now symptoms. All right, let's shift gears from the why into the what do I actually do right now? Because facts without action doesn't help you. And I want to give you a clear, logical order that you can follow starting tonight if necessary. The very first thing I need you to do, and I cannot say this strongly enough, is stop straining. Put the brakes on. Every time you bear down and push hard with a solid impaction blocking the exit, you are not helping. You are increasing abdominal pressure, irritating already sore tissue, and risking hemorrhoids or small rectal cuts. Straining will not move a fecal impaction. Not one single time in human history has white knuckling it on the toilet moved a hardened mass. So we are going to stop doing that right now. Step 1, greasing and softening with glycerin suppositories. Your first at-home help is adult glycerin suppositories, which are available over the counter at any drugstore without a prescription. Now here is the vital piece of info most people do not know. For a significant impaction in an adult, a single suppository is rarely enough. The standard routine for a hardened rectal clog in adults involves using 2 to 3 suppositories at once. One alone simply may not produce enough lubricant to coat and soften a large dry mass. Here is exactly how to do this correctly. First, do not stand up. Lie on your left side. This specific position, called the left lateral decubitus position, aligns the colon and rectum in a way that allows gravity to help rather than work against you. It also takes direct weight off the rectal area. Next, apply a generous layer of a water-based gel to each suppository before insertion. Do not skip this step. The tissue inside your rectum is already sore and irritated, and dryness at this stage makes everything more painful and more difficult. Gently, but firmly put all 3 suppositories as deeply as possible. You want them pressed up against or alongside the hardened mass, not sitting near the opening where they'll simply fall out. Then, and this is the most vital instruction, lie still. You must maintain this position for at least 30 minutes, ideally 45 minutes. The glycerin needs time to melt at body temperature, spread, and soak the outer surface of the impacted mass. It also needs time to signal the rectal wall to increase its own fluids. If you jump up and run to the toilet after 5 minutes, you achieve nothing except wasting the suppositories. After your 30 to 45 minutes, get up slowly, go to the bathroom, and allow your body to work without forcing anything. If there is movement, great. If not, stay calm. Do not be forceful. Step 2, rest, walk, and repeat. If the first round creates no movement, give your body a full hour of rest. Stand up, walk gently around your home, drink a full glass of warm water. Warmth helps soothe the intestinal muscle, and then lie back down and repeat the suppository process exactly as described. A second round is frequently what finally breaks through. The first application often softens the outer layer of the clog. The second round reaches the core. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It lets me know you're watching and getting value from this. Step 3. If home steps fail, it's time to go. I want to be clear here. If you have finished 2 full rounds of the routine I just described, waited the proper amount of time, and there is still no movement, or if you are experiencing any of those emergency signs I described earlier, it is time to go to urgent care or the emergency room. This is not failure. This is the correct clinical choice. At the clinic, the medical team has access to professional grade enemas that use larger fluid amounts and are given under controlled pressure, reaching further into the colon to break apart the mass from above. They also have scanning tools to see just how deep the blockage is and whether there is any danger to the bowel wall. Step 4. Manual removal. In cases where all other steps fail, a specialist will perform what is called manual disimpaction. I want to be honest with you about this process because it sounds scary, and knowing what to expect removes some of the dread. The doctor will physically break up and remove the hardened mass manually, meaning with gloved, lubricated fingers. In cases where the impaction is severe and the surrounding tissue is significantly sore, this is not done in a standard room while you're awake. You will be given proper medicine or sedation to prevent pain and allow the rectal muscles to fully soften. It is a serious process, but it is a safe, well-established medical help and the relief that follows. The immediate huge drop in pressure and pain is described by patients as massive. Clearing the current clog is vital, but I would be doing you a disservice if I stopped there, because if we don't fix the conditions that made this situation, you will be back here probably within weeks. And after the second time, the third time comes even faster. This is how chronic fecal impaction becomes a repeating cycle that gradually gets worse with each event. So let's talk about how to truly protect your digestive health for the long term, especially if you are over 60 when the biological factors I described earlier are actively working against you. Number 1, water intake is not optional. It is the base of everything. Water is the single most vital factor in preventing stool hardening. Your large intestine pulls water from waste as its main job. If you are not consistently giving your body enough fresh hydration, there simply is not enough fluid in that waste stream to keep waste soft as it moves. The hurdle for seniors is that the thirst reflex truly drops with age. You may feel completely fine and have no sense of thirst whatsoever and still be chronically dry at a cellular level. The practical tip: do not wait until you feel thirsty. Drink 6 to 8 glasses of water throughout the day, including a full glass first thing in the morning before you eat or drink anything else. That morning, glass triggers what is called the gastrocolic reflex, a gentle wave of intestinal activity started by fluid hitting an empty stomach. It is one of the most natural pill-free ways to encourage regular morning bowel movements. Number 2, movement matters vastly. Your intestine is not a passive tube. It is muscular tissue that moves waste through a rhythmic wave-like moving process called peristalsis. And here is something that most people do not know. Physical movement of your body directly triggers peristalsis. A 20 to 30-minute walk after meals, even gentle, easy walking, has been clinically proven to significantly speed up intestinal transit time. For older adults who are more inactive due to movement limits or chronic pain, even chair drills, gentle yoga poses, or simple waist rotation moves can help keep intestinal muscles busy. Long sitting, especially after eating, is one of the most overlooked contributors to constipation in seniors. Number 3, check your medications with your doctor. This one is vital. A wide range of commonly given pills, including opioid pain drugs, certain blood pressure pills called calcium channel blockers, iron pills, calcium pills at high doses, antidepressants, diuretics, and allergy pills, are known to significantly slow intestinal speed. This doesn't mean you should stop taking your pills. It means you should have an honest, specific talk with your doctor about your bowel habits. Ask them directly, could any of my current pills be contributing to constipation? And if so, are there options with less effect on my digestive system? Many doctors simply do not mention this unless you ask. You need to be the one who brings it up. Number 4, be very careful with harsh laxatives. I want to take a moment here to address something that I see cause significant trouble in older patients because it seems backwards at first. Stimulant laxatives, the kind that chemically force the intestine to move, are useful in real short-term times. But when they become a daily habit, something problematic happens. The intestinal muscle begins to rely on that outside chemical signal to start movement. Over time, without the laxative, it simply does not move. This is called lazy colon or laxative habit, and it is far more common in older adults than most people think. If you have been using stimulant laxatives daily for more than 2 or 3 weeks, please talk with your doctor before stopping suddenly and work together to stop them and rebuild natural speed through the other ways I've described. And if you've made it this far and you're getting value from this, type the number 4 in the comments. It's a simple way to let me know you're here and following along. Number 5, set a steady bathroom schedule. Your body has a natural inner clock, and your digestive system follows daily cycles just like your sleep pattern. The gastrocolic reflex is strongest in the morning, particularly within 30 minutes of waking and within 30 minutes of eating breakfast. Use that slot every single day. Go to the bathroom at the same time each morning, whether you feel a strong urge or not. Sit down, relax, and give your body 5 to 10 minutes. Over time, usually 1 to 3 weeks, your body begins to align with this schedule and starts movement on its time. Routine is the training tool. Don't skip days. And finally, posture matters more than you think. The human body was not built to go from a seated pose with the legs at a 90-degree angle to the floor. Biologically, a slightly squatting pose, knees angled upward toward the belly, fully eases the puborectalis muscle, a sling-like band that otherwise creates a natural bend in the rectum. A simple step stool under your feet when you sit on the toilet, lifting your knees above hip level, can meaningfully help the physics of moving. It sounds almost too simple to make a difference, but for many people, especially older adults with weakened pelvic floor muscles, this single change makes a huge improvement. Before I end, I want to address a group of viewers who may not be here for themselves, but for someone they love and support: an aging parent, a spouse, a sibling. Because fecal impaction is very common in bedbound or movement-limited elderly people, and the people who spot the problem first are often their helpers. If you are helping an older adult who has not had a real bowel movement in 3 or more days, who is complaining of abdominal weight or lower back pain, who seems unusually unwell, confused, or restless, do not assume it will fix on its own. The risks in a frail elderly person are higher than in a younger, otherwise healthy adult. Their intestinal walls are less tough. Their ability to share the depth of their discomfort may be limited, and the chain of problems I described earlier can move more quickly. Early steps include offering warm drinks often throughout the day, gently helping with movement or shifting to encourage belly stimulation, using a glycerin suppository early at day 2 or 3 of no movement, not day 6. And if there is any doubt, call their doctor or bring them in for help. A simple belly x-ray can confirm the presence and depth of a fecal impaction in minutes. Please do not be shy on their behalf. This is a clinical medical truth that affects a high percentage of elderly adults in both homes and care centers. The talk may feel awkward, but the results of silence are far worse. We covered a lot of ground today, and I want to briefly review the most vital things I need you to remember. A fecal impaction waste that is physically stuck in the rectum is not a minor bother. It is a serious medical issue that starts slowly, hides itself with confusing signs, and can turn into life-threatening problems if ignored. The warning signs to track for steady rectal heaviness and trouble passing waste: overflow fluid drips that look like diarrhea, trouble peeing, lower back pain, and in older adults, unexplained confusion or restlessness. The emergency help routine: stop straining right away. Use 2 to 3 adult glycerin suppositories with plenty of gel lying on your left side and wait at least 30 to 45 minutes. Repeat once if needed. If home steps fail, go to urgent care or the emergency room. Do not wait. And for the long term, prioritize water drink above all else. Move your body daily. Check your pills with your doctor. Avoid laxative habits. Set a steady bathroom schedule and use a footstool to improve your pose when you go. Your digestive health is not a small thing. It is deeply linked to your energy levels, your immune health, your mental focus, and your total quality of life. And yet, it is one of the most consistently ignored parts of senior health because people are shy to talk about it. Well, we just talked about it, and I hope you feel better informed, less alone, and more ready to take action. If this video helped you, please hit the like button. It truly helps this info reach more people who need it. Share it with someone in your life who you think might gain. Leave a comment below with any queries you have, and I'll do my best to get to them. And subscribe to this channel if you want to continue getting direct, honest senior health tips that doesn't talk down to you and doesn't hide the vital info. Take good care of yourself. Drink your water.